the treatment. Today we'll have, it's interesting before start to show how you can work with, this is a laser, this is a battery. The laser is around 300 grams, the battery is 400 grams. Normally I put the battery in my pocket, and first starting, the device has to be set. This is very little device, but is very powerful. 2 wavelengths, binary, means together contemporary. All right? This
Stay put in front of the lens, please.
Perfect. Okay? Yeah, perfect. So, what you can set. This is the first wavelength. It's the same as Fraxel. This is a diode laser, but the wavelength is the same of Fraxel. So we can start from 0 and go up to 50. 50 is very, very powerful. This time we'll start 20. Okay, going to the second wavelength, 1927. We know this wavelength as thulium. So we can go up to 15, very powerful. This time we'll stop at 3. After what we can set, it's very easy. It's like an iPhone. We can set the treatment area from 2 millimeters up to 14 millimeters. We set up on 1. And the density of the treated area from 0.5 to 2. We set up around 1. Okay. So this is normal parameter. Here you have the counter. The tip, I mean there is a tip I cannot detach now, but normally it's magnetic, and it's around 500,000 spot. And now that we use a tip for the 44%, we have 56%, and the counter will count every spot is give for both wavelengths.
What about
the tip?
The tips?
Yes.
Explain.
The tips I will show you after when you finished. This we can touch, detach, and retouch is magnetic. And these have this little rolls. Why? Because the laser works only if it's in contact with the skin. And normally you can use 90 degree or also a little bit less, you can see it, yeah? And if you don't touch, of course it's not working. So what does it mean? You don't need goggles, nor you, nor the patient. Exactly like Fraxel. So, having this device, you use in this way, in opposite, so it's bilateral. So, starting the treatment, I would like to emphasize one thing. This is the device, this is the laser. Normally, we have a handpiece, and the laser is here. We don't have laser here, big laser. Normally, we have a machine very fragile, because you can broken this, the cable, the machine. Here, you must be careful not to let this down. And you can carry in your pocket from one room to another, from one office to another.
It's perfect for plastic surgeon.
Exactly. For plastic surgery. Yeah, because dermatology normally have a big office, and plastic surgeon move with the bags from one to the other to operate them together. And
also, it's interesting because you are plastic surgeon and dermatologist. So maybe we can have a discussion about the whole point of view. How do you use it? What for? But I know that for derm it's okay. We have many devices and we stay in the same place. But even sometimes we work also at hospital. Okay, but for you it's very interesting. I like this kind of ultra portable devices to daily practice for surgery. Do you think you have to use? You need to be a doctor, you need to supervise?
Listen, it's depending where you are, according to the law. This, in some country, is also nurses are allowed, not medical doctor. In our country, in Europe, it's only medical doctor. But if you are allowed to delegate, this completely delegate. Why? Because it's very easy. Of course, it's a hand technique, so it's not a machine, it's not a scanner. So you will see in different way, but it's very easy to
the learning curve is
very easy. The most important thing is to set up the parameter. But we have table, very, very complete set.
Which indication for you first?
Yes, indication for plastic surgeon, scars is very useful. Why? Because you know we can treat red scars as soon as we have a red scar with 1550 nanometers and also with a lit power of 1927. If the scar is mature, so it's pink, it's finished, we can treat with more powerful both wavelengths, 1927. You can have a 4, 5, 6 millijoule and go up also for this. It's not ablative, but both, if you use 10 millijoule or more than 10, it's quite ablative. So you will see the little spot on the scars. Of course, you have to treat more than one. So if you do a CO2, you have less treatment, 1, 2. With this, you have 2, 4, 6. It's depending. And also, it's depending on the level of the pain you want to. Normally, scars are not very painful. These scars. But of course, you can have wrinkles, not ablative skin resurfacing. You have also the irregularity with the skin and the color.
Okay.
And there is a special protocol developed in Asia for melasma.
Yes,
in melasma, you know, it's
skin phototype. Yes, eye
yeah.
phototype, because you can reduce or increase the fluence very easily on for dark spot or many things. For me, my favorite is for acne scar.
Yes.
Okay, it's easy, but you know, sorry for that, but I treat a lot of scar after
surgery. Yeah,
because sometimes they're impatient or sometimes they use, you have laser. I say, no, you can change, maybe no. You can buy this device and follow your patient for all during after your surgery, lifting or abdominoplasty, mammoplasty, reduction. So really it's interesting for plastic surgeon. For them, yeah, we know very well the two wavelengths, thulium and 1550 is very common because, as you know, that Nikolai was the inventor of the frax cell more than 30 years ago. Okay, so it's interesting that Nikolai Tankovic, yes, sorry, he gave a lecture tomorrow afternoon.
Here. I think he's in the audience.
And you can listen to him because it's very interesting. He was a doctor. He's coming from Russia. He exported to USA and he developed patent for depilation and since more than 30 years, normally fractional laser. And he started with a frax cell device, and now he minimize the device. So it's not a gadget.
No,
not a gadget.
Not at all.
Okay, so some patients say it's a gadget. I said
some surgeon, some medical doctor.
Yes.
Trying to have very
big
machine.
The CE market.
Yeah.
Yeah. For
CE market. It's a FDA market. Is now present quite worldwide. Also in the eastern part of the world. So this is how use. It's really easy. Start. Wait 3 seconds, calibration, and when the point will start this color, you can start. So what's happened? I will treat this area. I will show. If I am slow enough, okay, the color is correct, no changing. You cannot hear the little sound, but if the speed is too much, start to becoming red. You see, and after the sound is changing. What does it mean? Then you are too fast. This is working, no changing the emission, but you are not regular in the treatment. So it's very easy. Normally we start, of course you can start in anywhere, so this area, and we do from 1 to 3 passes, depending we can do this way.
Yes, you have 2 directions.
2 directions, very easy. And this way,